Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
The topic today in Neighborhood Health Watch is gestational diabetes screening. It occurs during pregnancy and it changes how cells use sugar or glucose. Gestational diabetes causes high blood sugar and can affect your pregnancy and your baby's health. If left untreated, some of the complications are excessive fetal growth, higher risk for birth trauma, and late pregnancy stillbirth. Dr. James Christmas with Henrico Doctors Hospital is here to talk with us. What a perfect time to have Dr. Christmas in the studio here in December. But you're not going to talk about Christmas. You're going to talk about gestational diabetes. How often does it occur and why in some pregnancies and not others?
Sure, and thanks for having me, especially during the holidays.
Yes.
So gestational diabetes develops during pregnancy because pregnancy changes the way humans process sugar. And everyone becomes a little more diabetic when they're pregnant than when they're not pregnant. Depending on the population you look at in the United States, anywhere from as low as 7% to as high as 20% of pregnant women will develop gestational diabetes during pregnancy. One of the biggest risk factors is obesity, and as everyone knows, we're in sort of an obesity epidemic in the United States. 30% of pregnant women 30% of adults in Virginia are obese. And that goes up each year, and as that goes up, the incidence of gestational diabetes goes up.
What happens after the baby is born, and will the mother go back to normal medical condition after childbirth?
So patients that have gestational diabetes are at increased risk for developing type 2 diabetes later in pregnancy. They're also at increased risk for developing cardiovascular disease later in pregnancy. One of the biggest sort of steps to control gestational diabetes would be preconceptional weight loss. Losing even a little bit of weight prior to pregnancy decreases the likelihood of gestational diabetes.
So it sounds like you're saying everybody is, it can happen to any pregnant
Everyone
woman.
has some risk. Pregnancy increases the risk, obesity increases the risk, a family history of diabetes increases the risk. Certain genetic populations, certain ethnic populations have higher incidence of diabetes as a background and also have a higher incidence.
But the good news, you can control it.
Not only can you control it, but when you control it, you take virtually all of the adverse outcomes associated with it and improve the likelihood of those.
Dr. Christmas, thank you so much for joining us.